Welcome to the three-part webinar series, Expand Your Digital Knowledge with 3Shape Trios. It is being presented by Kelly Bevington, RDA, EFDA, and Brenda Kirkin, CDA, RDA. Today is part 3Shape Trios, Advancing Your Knowledge Base, and we're going to begin that webinar shortly. And with that, it is my pleasure to introduce our guest speakers tonight. First up is Kelly Bevington, RDA EFDA Director of iOS Technology here at National Dentex. She began her career more than 20 years ago as an RDA EFDA, graduating from Bryman College. Kelly has comprehensive knowledge of dentistry and the dental laboratory industry. She has been professionally trained on most major devices and is able to provide expert chairside coaching. Kelly manages the NDX clinical iOS training team and has clinically trained over 1,000 dentists and their teams. Kelly enjoys sharing her knowledge by presenting webinars and is a regular contributor to dental publications. And we have Brenda Kirkin, CDA RDA, iOS Clinical Training Specialist. Brenda has served in dentistry for more than 25 years and is a certified dental assistant and registered dental assistant, and has served as an adjunct instructor at the University of Detroit Mercy School of Dentistry. Brenda has extensively trained in such areas as impressions techniques, both iOS and PBS, retraction cord placement, provisionals, and photography. And with that, it is my pleasure to say, take it away, ladies.
Thank you. Thanks so much, Jessica. So tonight it's advancing your knowledge base. I just want to go over the course overview. So this is what y'all registered for and what we're prepared to educate you about. And so tonight is going to be about scanning a crown under a partial, doing some edentulous scanning, as well as introducing you to the 3Shape Trios Excite apps. So we're going to learn about the actual workflow for scanning a crown under a partial. And Brenda's really excited to share her preparation experience. You know, we're working on type-it-ons and not with real hand pieces. So it was a fun adventure for her preparing for tonight. And then optimally how to scan a wash impression for an edentulous patient. And that will be a hands-on demonstration as well. And then lastly, to evaluate your software. How can you evaluate your 3Shape software to identify which Excite app capabilities you have on your particular system? Some come with the software that you purchased, and others are add-ons. So just to educate you on how to determine that. I do want to make it clear that both Brenda and I are full-time employees of NDX. That's our presenter disclosure for you. And again, it's advancing your knowledge base tonight. So the clinical training team consists of myself, Brenda, and Brittany Carey. Brittany is on the West Coast. Brenda is predominantly Midwest, and then I'm predominantly on the East. And tonight we are talking about removable partial dentures and complete dentures. So I always like this slide because years ago it was, you know, fixed crown and orthodontics, and that was about the only two things you could scan for. And every year something else is added. The technology has evolved tremendously, especially just in like the last 2 to 3 years. So we're really excited to share some, hopefully, what will be new techniques for you tonight. And as a best practice, I like to revisit, especially when it comes to the removable type scanning where there's some missing dentition and retracting the lips and cheeks can be a little more cumbersome, is the use of some sort of lip and cheek retractor. So the Obturgate in the bottom right-hand corner is disposable. The one directly above that, the Comfort View, is autoclavable. Both work very nicely and are pretty comfortable for the patient, good patient compliance. And then the lip and cheek retractor that is the ScanMate is an actual handheld autoclavable device. So it is anti-reflective, it's black, and the head can bend, the neck of the head can bend a bit, Really nice to be able to retract the tongue or even the floor of the mouth when scanning intraorally on the mandibular arch, and it would require employing the use of four-handed dentistry. It would be difficult for one person to use that and scan at the same time. And then for isolation, keeping the area dry, my favorite is the neo-dry dry angle that goes against the inside of the cheek against a parotid gland. Really helps to soak up that saliva when you're retracting the cheek. Sometimes it milks that gland, and it can help keep the area dry. So the mandibular scan path protocol for trios, and this is for intraoral. It's a 4-swipe scan path. So you're going to start on the retromolar pad, go lingually, and then back out buccally, followed by the opposite, right? Starting at the midline along the lingual, coming back along the buccal, and crossing the midline. Bear with me, I'm not advancing. There we go. So fully edentulous scanning. Brenda's going to focus on the actual wash impression technique where we've had the greatest success. And so this is the second path, right? The third pass, and finishing with the fourth. Now, the upper is going to be a little bit different. It is still going to maintain 4 separate passes, though. And this time, you're going to start at the hamular notch and come towards the midline. Then do the palate, sort of like a Christmas tree is, or a pine tree, I guess, starting at the rugae and then going to the post-palatine seal. And making sure that you're capturing the vestibules to the best of your abilities. And so that's the fully edentulous scans. And I will say that as far as going to fabrication of dentures right now from an intraoral scan, the process that we as a laboratory prefer is scanning an impression, whether that be a wash impression inside of your denture or an impression inside of a custom tray. So what you may get back from this particular type of intraoral impression, or scan rather, digital impression, might be the custom tray itself that you would take the PVS impression in to start that next process. Brenda's going to review specifically number 3 on the different options there are to scan for a crown underneath an existing partial. And I do encourage you to contact your specific laboratory that you're planning to send the crown to. Every technician that I speak to sort of has their own way that they would ideally like to receive the data. And Brenda's going to review specifically what the majority of our labs prefer, and that is number 3, where the existing dentition it is made whole, if you will, so that if it was broken down in any way, you're able to perhaps take a scan of the temporary that you have made like after the fact for the lab to follow. It could be composite that you build the tooth up with as well. But whatever technique you employ, you want to make sure that the clasping and the rest seat were embedded into that temporary or composite that you temporarily built the tooth up. And then lastly is touching on the engagement apps. A little bit with smile design, So the engagement apps are Smile Design, Treatment Simulator, and Patient Monitoring. And again, Brenda's going to show you where to find them on the system and sort of take it from there. So I'm going to stop sharing so we can get to the fun part. And that is the actual scanning itself, right? So let me stop that. I see a couple things in the chat, so I just want to make sure there aren't any questions or anything. There does not appear to be. If anything comes up, please don't hesitate to ask the question in the Q&A box or the chat function, and I'll monitor that while Brenda is working on the Trios itself. Thanks, Brenda.
Thank you. I am going to share my screen. Okay, so right now we're going to start off with a tooth underneath the partial. And I took a couple different scans. There's different ways to do this. Let's say the tooth is made whole and fits the partial. Maybe there's an existing crown with the rest seat and has a leaky margin. So we know we need to cut that crown off, but we would like the lab to duplicate what is there already. So I have an example of what we would do. We would just do a scan only under a new case. So we're going to open this up because I've already scanned this one in earlier, but what I would like you to do is on your add case instructions, this is going to be file 1 of 2, and it says pre-op prep of crown number 28 with rest seat on the distal occlusal. And that's important for them to know because unfortunately, none of the scanners have an unlimited amount of libraries or scans that you can take. So I wish scanners allowed you to take 4 different scans, but it doesn't. So all you need to do is to scan the arch without the partial in and with the tooth that's not prepped. So we're doing number 28. And I just want you to see what it looks like. I always look at it in model form. I did not take this impression. I did not pour it up. So this is an existing one that the lab allowed me to prep my very first tooth with a Dremel, mind you. So I did not.
This is a real case, right? Yeah.
Yes, this is a real case.
Yeah.
So that is one way. Another way is if you had the tooth was so broke down, and I'm going to open this one. If the tooth is broken down, but it's really important to see the partial. I'm going to open this case up. You can scan the partial without the tooth. And on my case instruction here, it's file 1 of 2, crown prep 28 under partial denture, unable to get a pre-op scan due to excessive decay or broken lingual cusp. And so there would really not be a reason to try to duplicate that tooth, but it's nice for the lab to have the partial. So I scanned the partial, which scanned wonderful with the Trios 5 that I have. I know like the other generations, it's kind of difficult because we do have that metal that's really shiny. You can use occlude to dull it, so you can scan it. But right here you can see, I mean, that's like giving us, the lab, the existing partial. So they will put that, I wish I had photos of in the lab design, how they can import all these and model mesh them with their system.
I mean, that scan really worked out beautifully. And what was your tip on capturing the inside of the clasp, or the way best to hold it?
Would everybody like me to demo that so you can see how that was?
Yeah.
I will delete the scan. I am going to turn it on to, I'm going to share my camera. I'm going to take it off my model.
So currently we can see the Trios
Okay,
screen.
so let me take that one off then. Okay, so as you see, it is very shiny. So we are going to, I need to wait for it to turn on here and get ready. Okay, it is. So if you're scanning for a partial, you don't want your fingers near that area. So I am going to start off. And I know I can't, I'm just going to show you.
Thanks, that's great.
And then when I get to that side, I'm going to move my hand to the other side. That way my finger does not get in the way. And then I'm going to grab it again from the other side. And then I'm just going to come around and do the intaglio. And I guess it's not used to the, I mean, I have these other bright lights on it. I'm going to take that off. And just like I always say, when you're scanning, turn off the overhead lights. Having 2 camera lights on. Take that off right now. Because that's too bright for it. Okay. And there's a couple little areas there. I wish I could do like a split screen with my Trios on at the same time. That would be very helpful.
You could switch it back to the Trios whenever it's convenient for you. I just thought it would be interesting for people to see how you really truly have to sort of manipulate it and be careful not to get your finger underneath the clasp or the rest seat, even though the AI is going to remove your finger. It sort of got stuck in that rest seat. I know before when you were showing it to me.
Yes. So I'm going to finish up this little area now.
And I'm sure my team is getting tired of hearing me say this, but like when we're scanning natural dentition, it's been ingrained in our brains to go fast, right? We want to go fast, 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 complete and accurate, but fast. And when you're scanning a partial outside of the mouth, or you're scanning an edentulous area or the denture itself with a wash impression, you need to go painfully slow, like really consciously going slow. If you go too fast, it can't keep up. And that reflective quality of the acrylic and the metal makes it difficult for you to get like super speed like you can with dentition.
Well, as you saw earlier, like when I did the other scan earlier, I did not have any of these lights. So in reality, if I started over on this, but I just wanted you to see, but I have my little finger over here in the way.
Yep.
But yeah, from having the lights from the camera on there, it made it very reflective. And I know like on my other one, I only had 550 images instead of the 1705. So very important. Like I said, do not have overhead light on. Make sure that when you're scanning the partial, it's in a little darker area.
Cool.
So this one is not that great of a scan. It's not acceptable to me. I would dump that one and redo it. But I just wanted to show that you can capture that and you'd send that to the lab.
Got it.
Okay, so now we're going to do it so that those are two different ways, like one for your pre-op of the tooth before being prepped. If the tooth is broken down, too much decay, then you're going to want to then scan the existing partial. Or if you feel more comfortable, I always say you can do actually 3 files. File 1 of 3 would be the pre-prep tooth. File 2 would be the scan only of the lower or whatever partial is underneath that the crown is fitting, your partial that the crown is fitting around. And then this next file is like a normal workflow of the prep tooth. And you need to scan the prep tooth and then the partial in place. Just like if you were doing a PVS impression after you prep the tooth, you would seat, put your light body and then heavy body, and then you would seat your partial and then, do your, with your tray to capture that. So now I'm just going to use this one. I'm going to do a new case. I'm just going to choose a lab. We're going to do our single restoration. It's going to be a crown, number 28. Our material, we're going to do zirconia. Shade is A2. Save it. Your delivery date. Since Jessica talked about Halloween, we're going to put Halloween. And on the case instruction, this is where then you can write file 2 of 2. And whatever note you want to put, crown prep number 28 under existing partial. And now we're going to go to next. Okay. Let me go back there for a second. We need to click on pre-prep. That way it gives us 2 scans for that tooth that we're working on. Now we can scan. And I am not going to go to the camera. I'm just going to go ahead and scan this because on our other webinar on crowns, then it shows the correct scan path. However, if you are ever stumped on, okay, which direction that, if you click on I, it will go over your scan path. And then once you start doing it for a while, then you have it. So the tooth is prepped, and we're going to place retraction cord, let it, I'm a double cord technique person. We're going to let it sit there for at least 5 minutes, right? Because you need that lateral retraction so you can see down into the sulcus. Gonna pull that cord, because I'm a 2-cord. My top cord is gonna be pulled. I'm keeping the other one in the sulcus, and we're gonna place the partial in the mouth, and now we're gonna scan it with the partial in. I'm going to take a little extra time here where the clasp is. And then I'm going to stop. And now I'm going to mark my tooth. And it's going to show me some arrows where it's saying missing data. I am going to go ahead and I'm going to use the zoom tool on that, because I would like to get a little bit more underneath that clasp. And you kind of just rotate it to get those areas. And then I'm going to end up on the top, and then I'm going to stop. And the next part is a little bit tricky, but don't get intimidated by it. On all those other little marks, I'm not that concerned about that area. I'm going to get it on this next scan. I'm going to take the partial out. And if you see how it punches the area out, I'm going to trim a little bit more, only because I want to make sure my margin, that you're able to see that. Well, I'm going to click done. Now, sometimes this is tricky, especially if there's so little dentition. Sometimes you have to put the partial in for a second for the scanner to capture it, because it's not going to recognize it when you only have like a few teeth. So I will start my scanner so it starts capturing. I remove it out of the mouth, and then I come back in. So then I can capture all the way around my prep.
Mm-hmm.
And then I'm going to come out and then evaluate it. And like I said, this is my very first prep on a stone model with a Dremel, but we are going to need to evaluate it. We always want to look at it in stone form, right? So I'm going to mark the tooth. Going to look at everything in stone. And I like to look at it underneath to make sure that I had proper retraction, that it was nice and dry. And everything looks great to me. Now I'm gonna scan my upper.
Nice prep for a Dremel tool, Brenda.
It was like, can I find a smaller burr? I've over prepped, but you know, and I have a double margin in a couple little areas, but
And please, any questions that are coming to mind, feel free to jot them into the Q&A or chat box.
and on the opposing, yes, I'm just gonna go along it. Sometimes when we're doing our webinars, the scanner does a little bit of like it's almost static is what it sounds like.
Yeah.
So I have, and this is going to be very interesting. So before you do the bite, you're going to want to put the partial back in. Make sure it's seated correctly. And this is going to be almost like Homer Simpson bite, because I do not have the actual upper arch for this lower partial. And after you hear your magic music, then you make sure that the bite is correct in the patient's mouth. Then you come to the other side.
Yeah, really good point. Anytime you're doing full arch scans, you want to make sure that you're taking a bite on both the left and the right side of the patient.
And you want to make sure it is a correct bite. So now we're going to post-process everything. That's that little tooth with a little rainbow. And then, well, that takes you to that post-process page. This will have everything cleaned up. So if you have more data, it takes longer to process. And I think because I deleted my, or like taken time, I'm trying to pull my partial off of there. So anyways, this will show, here's the prep with the partial. See how nice that turned out? As you can see, then with either of those other scans, like if the tooth wasn't broken down, or even if you built it up to fit the partial and then did the pre-op scan, they would then put all those files together. So it would show what the existing tooth looked like. They're able to put all those files together. But here is the prep with the partial intact. Here is the scan with that shows just the prep tooth, so you can read your margins. And let's evaluate my Dremel prep. So any questions on that? And then you would just send these out. So
Awesome. It's amazing the clarity that that you can capture of the intaglio of the clasp and
yes.
receipt.
And then yeah, see, it's,
yeah,
when you look underneath it, even the clasp all the way around. But
very nice.
You always want to evaluate everything in this stone because that's the way we at the lab see it, right? And then the bite, like I said, it's like Bart Simpson, Homer Simpson, one of the Simpsons. So there is that part of taking a scan underneath for a prep underneath a partial.
Great. Thank you.
So the next that we can do is we are going to scan for a denture. And I'm going to stop sharing my screen for a second. Well, you can see my face, correct?
Yeah.
So when you're scanning on an upper, the palate of, like the lingual side of an upper denture, it is a lot of times so smooth and shiny that scanners have a hard time capturing it because it's reading it as the same area. So I just do it automatic now because there have been so many times it's like I've had to stop my scanning to put a little flowable on the palate. And I just do like a snake. And I usually start like right by the palate, the premolars, and then come down all the way. And that way it captures the scan. The scan captures it really well because scanners look for lumps and bumps and landmarks. So
You applied the flowable. It's on the cameo side, on the tongue side, if
yes,
you will.
yes,
And it extremely helpful if the patient has a high vaulted palate as well,
yes.
because it can be difficult for the head of the scanner lens to actually capture there. Nice tip, Brenda. Thank you for
Yeah,
sharing.
that, or you have those patients that have such a wide arch and
Yeah,
it's all acrylic. I mean, it's like
very flat.
very flat. So we're going to go to removable. And so if a patient has an existing denture, that is like the best custom tray that you'll ever get in your life for that patient. So let's say even if the patient broke it in half, glue it together, and then I like to do either a rigid border to border mold, depending on how old their dentures are. If it's fairly nice fitting still and has a little bit of suction, I would just do a little heavy and light wash in it. And I usually like the blue and green material. It shows up much better. It's easier to scan that. So we're going to click full denture, upper arch, and for the material, we're going to say we want it milled. We're going to save. So I'm just going to do the upper because I don't have a lower and I want to get into the other excitement applications to show you where they're at. We're going to do an upper.
Before you actually start to scan, this is a great question. I know you and I spoke about it earlier, but when applying the flowable, how does it stay? So you tacked it, right? You did a light cure, just tacked it. Yep.
Yes.
And then here's the good part of the question is, what's the best way then to remove it?
You could just pop it right off.
It does pop right off.
Okay. Yes. And another thing, before you put a wash, heavy body, light body in your denture, I would put a little adhesive because you don't want it to flop around. On this one, when I'm scanning, you'll see that there's like a void. Make sure there's no voids. You want it to almost like if you were to do a reline on that denture. Sure. But as you see, there's 3 different libraries that come up: intraoral, impression, denture. And I know that Kelly was talking about like how a lot of times if you do on the intraoral that you have to, that a custom tray will come back. You can do a little bit different workflow that I have done. So when they get the try-in, if they went to a try-in or base plate with wax rims, you could also do a wash in there. That way you can capture the vestibule and you can have them do the movements that they need to do, if you're doing both upper and lower denture. And we'll go over a lot of those tips and tricks on our next webinar. So we're going to click on denture. And once again, right here is hints that would tell you here's one. And then once you do that, then you go to the buckle. And then you would go to the lingual, fill in the palate. Then you will roll over. And then you would then stop it and let it all process together. And then you would scan here. So I'm going to go over that without turning my camera on this time. And same thing, you want to keep your fingers and stuff away. I'm going to get a different battery real quick. Switch that out because I don't want it to stop in the middle. Has anybody tried scanning a denture before in our audience? So try to keep your fingers away from it because it will capture it. And sometimes I'll just kind of like do zigzag motion to capture all this. This denture has a very high vestibule. Most people do not. Yeah, so just take your time. And as you see, it only takes a few minutes. Okay, now I'm going to go to the lingual. And as you see, it will capture. Don't worry, the lab won't make that little snake mark in the new denture because they know that people don't want a little squiggly ziggly line. Okay, so now I'm just going to roll it around. And then I'm going to turn it off and let it optimize. And you should not be, Kelly turned off her video because sometimes when we're scanning, if there's too many people on the video, then it will do that little hopping and jumping that you saw where little lines. Okay, so now that I have that into the intaglio, now I am going to then finish up scanning on the inside. And then I just move my motion is almost like I'm painting. And now I'm going to try to capture all the way around. And I see in that area in the anterior that I need to capture. That's that little area that I spoke of that has a void. And if you have loose material, or even if you're scanning edentulous, if the patient has a lot of like they've had dentures for a while and they're it's not nice and stable, it can be very difficult to scan. So I wouldn't even attempt it. I would just go ahead and take an impression and then scan the impression. Because if it's moving around, it's not going to, the scanner will not recognize it, if that makes sense.
We did have an attendee answer the question, yes, that she has or he has scanned for a denture with the trios.
And how did that work? Did you enjoy it? So I see this hole here. I'm just going to go capture that back in. Okay, so I know like I like to look at my before I send anything out to the lab, I like to view my lab slip to make sure that all my scans have come through. With edentulous, if you see something odd in that area, I'm gonna post process this and then show you what I'm going to be talking about. The AI doesn't recognize color, and so sometimes it can have some weird, when it's in color, it can look kind of different. But as long as you see it in stone and it looks correct, you have all your data that you need, you don't have holes, don't worry about if there's odd colors or like streaks on your printed form. And I'll show you that for those. So I'm going to look at this. And that captured nicely. As you can see, those little voids, you wouldn't want that, but that's all I have here with this one. So I'm going to go look. So if you look at the view print version, if you see how my upper denture has, it looks psychedelic almost. That's not what the lab will see. They will see the actual file in stone. Does that make sense?
Yeah.
Because AI doesn't recognize it. So I'm going to go out of that. And now we're going to talk about the different applications. So I'm going to go to new case. So here is where you can find if you have the treatment simulation, the smile design, or the patient monitoring. And I'm just going to show you a couple little demos on there. I'm not going to have it under my name. So patient, we're going to go like smile design first. And you're going to want to take different photos, and it will tell you what photos that you need. It's full face, smile, retracted view. So let me think right here if it. So you can upload photos that you have taken. And once you have everything that you want, then you can adjust. You need to put the points on the pupils, the little spots out the nasal, labial, and then you want to draw the lip line. So if the lip was down further, then you could then change that. Once you have all those marks where you want, then we can go to the smile design, and there's different libraries that you can mess with here, like on the teeth. You can also do a suggestion. And on the bottom, it'll say best, great fit, good fit. And you can adjust wherever you need to. And then you can show the patient, oh, this is what your teeth would look like. There's also, if you wanted to do the color, you can change the shade. She wants blue teeth, really white. And then you can show. So there's smile design. And now we're going to go to our.
And smile design is typically an add-on. Is that correct?
That's what, yes.
I think sometimes with brand new purchases, a bundle of introductory software might be included, like for the first year, maybe just the first 90 days as a little taste. But I would ask your reseller about what Excite apps, if any, come with the Trio software upon purchasing it.
Okay, so these are not my teeth. This is like the models that I was scanning. So I'm going to do like treatment simulation. Okay, we're going to open this up. And that is if you're going to do for ortho or any other type of work, right? So I have my lower, my upper. I'm going to go to the treatment simulator. We're going to look at the upper, and here's the animation part of it that will show movement, as you can see there. And if you want model color, realistic. So there's different things you can move the teeth if you wanted to. You can do a comparison slider of before and after. So that's for the treatment simulator. So you can move teeth. So if you wanted to see number 9 flare down, you can change how it may look. And then the other nice app that we have is you find it, the patient monitoring. So you need to have a couple different scans to monitor to see what has changed. So we have a couple that are from before. So we're going to open this. And this is good for hygiene, right? So if you wanted your hygienist to implement, I'm trying to see here if it's, well, that one doesn't have enough scans in it. Get both of them there. I think I might have clicked on the same one.
How much time needs to be in between the two scans, Brenda?
Well, I know like if you have perio patients and they're coming in, every 3 or 4 months, if you wanted to, you can do then, but most people usually scan once a year. That way they can.
And you could see some substantial changes in a year's time.
Yes. And I love to show patients in stone because especially with abrasion. So right here is it'll tell you like what colors or what you might want to tap on, right?
Okay.
So if you wanted to see from 2014 to 2017, let's go here. Confirm that. And for some reason, this is so with your monitoring, it usually has a video here. I think I have the wrong demo one because it should not show the teeth there.
Does the slider bar slide? Maybe?
Yes,
Or they're too similar?
this one looks too similar to me on
Yeah.
this one. But it usually will show, let me see if I have that other one, if it was.
Well, I know that this was just an introduction
Yes.
to the apps, right? There is a question, if you could kindly show them where to initiate, where do you start the smile design? That very first step was missed.
The very first step, so you put your patient in, and then, so let's say I'm going to use mine, then you would add a new case and you would go to smile design if you have that app.
Okay. If you have the app, this is where it's going to show up.
Right.
Got it.
And then these are the photos that are required. Then you could get it from your PC. But under mine,
You can have it in a USB or from
yes,
your
yes.
actual
So,
camera as well.
Right. So if I had one on here, I could click it and then bring it up. So let's say if you had photos in there already, and like I said, that smile design is here. I'm going to open this case up. And what's nice about this, so if you have everything set up, like if there's some rotation or patient had veneers before and they have some rotations, you can always send this to the lab after you have it for a mock-up. So
Okay.
then you can also do like almost like a functional PMMA try-in for them.
Yep.
So the patient can take it home.
Yeah, we see
have to be
more and
really
more
careful.
requests for that. Yeah, for sure.
Yes.
For sure.
Yeah. So right here is where you would click for the photos. Here's where you would adjust, put where their pupils, outside the mouth,
Right.
with their big smile. You put the marking points. Here is where you can do your different libraries. There's quite a few. And
Nope, I think that was good.